Hi, I'm Professor Cindy Lin. So I'm the inaugural Lin Barbara Low Chair in Neurodegenerative Disorder at the Brain and Mind Center that is under University of Sydney. So I actually started my career in biomedical engineering, and now I just specialize in using the neurophysiological techniques to basically study or detect nerve damages at the early, so before the symptoms arise. My research focuses on a whole range of neurodegenerative disorders, and of course today it will cover the most prevalent, which is that everyone knows about, which is the diabetic neuropathy. So, diabetes is something that we often just think about blood sugar, for example. And most my diabetic patients that I've seen, because all they are really trying to concentrate on was what is their blood sugar levels. But actually, it also causes the damages throughout the body, and of course both in the hand and feet, and not surprisingly, in the brain as well. So many people with diabetes, they usually, what diabetic neuropathy symptoms are, they will experience numbness, tingling, pain sometimes, or they have some balance problems in their feet and hand. So these are the early signs or the symptoms of the nerve damage. However, what's less well known is that diabetes also dramatically increase the risk of memory loss and dementia. So some researchers even call this type 3 diabetes. So we know that there's the type 1, that is the genetic form, and then the type 2 diabetes is the acquired diabetes, and how the type 3 is now basically the dementia, how actually the brain and the diabetes are really closely linked. So the real problem is that by the time people notice that they have these symptoms, that shows some significant damages has already occurred. We can't really detect the nerve problem until it's quite advanced. So then people may be at risk of, like, for example, serious fall, or they start to have some cognitive decline. And in some diabetic patients, if they have severe neuropathy, then they basically will face like amputation in, for example, the toes. This is actually a very exciting project because this is the first collaboration between neurology and endocrinology. So I was very pleased that Brain Foundation actually noticed that the sort of new collaborations that we have, so to cross multidiscipline. So it's not just the brain, but also that the whole entire nervous system. Our project really focused on catching these problems early before the reversible damage happens. We have this very specialized non-invasive test that will be objectively measure how the peripheral nerve functions are. The underlying mechanism is we hope to really detect the changes as early as we can. So, or put it this way, that we're trying to find the smoke before the fire. So first, we wanted to test the nerves in the people who has diabetes in their hands and feet, and to see how they might respond to, for example, things like heat or cold and touch. Because sometimes the changes will occur with these little changes first, before like the severe symptoms such as pain or numbness. We were hoping that by using this project, we can use our specialized quantitative sensory testing machine that will give different thermal stimuli, like the hot and then the cold, and see how the patient can first detect. And that will give us an idea of how the nerves are functioning. And then we would like to see if that change happens prior to any other severe symptoms. And then the most important part of the project is actually to look at the relationship between how their peripheral nerve function and as well as their cognitive function. So the second thing we assess is their memory and thinking abilities using some already validated screening tools. We're going to be looking at how their memory retention and problem solving. So for example, we can tell the subject that 3 different names of the flower, for example, rose, daisy, and tulip. And then we ask them other questions. Sometime later, we will then ask them what were the 3 flowers named that we've just mentioned. So this is just like a very quick and validated way of testing the memory. So what makes this study unique is that we're really looking at both the peripheral nerve and those in the hands and feet using already that we specialize neurophysiological testing and to link with the cognitive function at the same time. Because we believe that there's a very strong shared degenerative process that's affecting both systems. So if we can identify how both areas are affected, then we can potentially predict who's at highest risk for developing serious complications. Actually raise quite a lot of awareness across both the endocrinology world and the neurology. Because the sad reality is that in neurology clinic, you don't get to see the diabetic patients until they have already pretty severe neuropathy. So the first thing about this project is we really wanted to detect the changes early, and that will hopefully prevent, for example, these patients that they fall and the injuries from their balancing problem, because patients don't really relate diabetes with their nerve together, interestingly. And then hopefully in some severe diabetic patients, we could avoid amputation. This is why a lot of patients, they could be walking on the beach and then they don't realize that the feet is burning because they actually already lost the nerve functions to the feet and the toes. So it's already severely numbed. And so that would prevent some unnecessary amputation and also slowing some of the memory lost so that we can actually detect or give them some neuroprotective approach or help before the dementia hits them. And so overall, that's gonna hopefully to improve all the quality of life of the millions of people that suffering from diabetes. So the vision, our goal is to transform how we monitor and manage diabetes. So instead of waiting for complication to develop, so we really want to shift to prevention. So, and thank you for the support from the Brain Foundation. That so me and my colleagues, Professor Stephen Twig from the head of endocrinology from RPA, that will be able to focus on this research with the seed funding, and we really hope to collect some really useful preliminary data that will help us to build our research to more extensive research and hope to really change the management in the current diabetic clinic. Thank you.